Dr. Gray, what essential testing should people with ovarian cancer have following diagnosis?
Yeah, that's a great question. We're learning more and more about this disease, and therefore we also have a lot more variety of tools to look at to be able to match better therapies for patients. Historically, when patients were diagnosed with ovarian cancer, it was based on just the pathology at the time of surgery and some lab testing called the CA-125, which many patients with ovarian cancer are familiar with. The next level of testing that we are doing for ovarian cancer is really to look at how aspects of either the patient themselves or of the cancer themselves that might better match therapies. So the first kind of line of testing we recommend for all women for ovarian cancer is genetic testing. And genetic testing is blood-based testing. It's testing for if you have an inherited gene or a mutated gene that's being passed along through families that may have put you at risk of developing ovarian cancer and potentially breast cancer. And that's recommended for all women and patients who have been diagnosed with ovarian cancer because we know about 15 to 20% of these cancers are due to a genetic cause. The other level of testing that we have incorporated is what we call this molecular testing. Other terms for it are tumor-based testing. I think you use the term biomarker testing. Some people use the term precision medicine, and that's a little different. That's testing that's actually testing the tumor itself. It's looking at a variety of different factors, but particularly looking at mutations in the cancer itself, in the tumor itself. So different than the genetic, which is an inherited thing. This is in the tumor itself. Some of them, there's some overlap of that, but it has an expanded profile of different targets that we can match therapies to.
Would you define biomarker testing for us?
Yeah, so biomarker testing just is that it's this more expanded testing, particularly of tumor testing is one aspect of it. There can also be some blood testing, genetic testing, and then there is a new realm also of looking at cell-free DNA or CT or tumor DNA in the blood as well too that is gaining a lot of interest.